to the Insomnicat Show with Nicolette and Brian. We'll get real deep with you, educating, inspiring, and solving problems with some of the most inspirational humans on the planet. Buckle up and come on the journey.
I'm excited. All right. All right, guys. I'm Nicolette, and today Brian and I are here with Melissa McDonald. She also goes by Dr. Mac, and she is a sports chiropractor who's going to talk to us today about healing and movement and some other fun stuff. So thank you for joining us today, Dr. Mac. We're happy to have you here.
Oh, I'm very excited to be here. Thank you for having me.
So before we get started, why don't you kick us off and tell us about your journey to chiropractic medicine and your practice?
Absolutely. So growing up, I always knew I wanted to help people. I knew I wanted to be in the medical field. And growing up watching Grey's Anatomy, I wanted to be a surgeon. And I started shadowing surgeons and seeing how they interacted with their patients. And I realized it, one, wasn't Grey's Anatomy, and two, wasn't quite how I wanted to interact with my patients. I wanted to really understand their stories, get to know them, and work with them to help them achieve what they wanted. And I was recognizing, one, here in the US, our healthcare system is frankly broken. We don't really work with patients on preventing illness. We just act in a reactive sense. And I didn't like that. So I started to look at some other options, from physical therapy, family practice, and chiropractic. And my mom, who's actually a physical therapist, was like, look, you don't work well with others. You're a bit of a control freak.
Stop
You're
talking
not
about me.
I'm like, oh, mom, you know me so well. You're not going to do well as a physical therapist because you're going to have things dictated to you by doctors at that time. And now they're DPTs and they can work more independently. And she's like, you should go be a chiropractor. When she was practicing, she's like, we loved referring to them. It worked really well. And I went and became a chiropractor. Now through school, I found out there's chiropractic specialties, and I never realized that there were actually nuances within chiropractic so that you could specialize in pediatrics, radiology, sports, internal medicine. And I also, because I'm kind of crazy, decided to get my EMT simultaneous, and I started working high school sidelines. And I got the sports bug bad. So with that, I then applied and got to do a 2-year fellowship post-graduation, just focused in on sports and athletics. I was the team clinician for the Minnesota Vixen, which is a professional women's football team that's been around for 23 years. I think this is their 23rd season. And I got to work with those high performance athletes and actually travel around the country, helping care for them right there on the sideline. And then I opened my own practice, and I'm basically doing the same thing. I've now partnered with 3 teams: Minnesota Roller Derby, River City Rhythms, which is a drum corps international marching band, and the Minnesota Pride, another women's football team.
That is so cool.
So I have a question right off the bat. So working with athletes, much different than working with normal people. Do you find they're
Normal people?
well, or there's okay, the non-athletes, I don't know, however you want to put it. I guess we're all normal people, right? But
No, we're not. Nobody's normal.
yeah, that's true. I guess no one's normal. So all is non-normal people. But here's why I'm asking, right? So do you find they have like sort of like this different threshold, because you see athletes like sort of push things off a little more, even though they're good about getting looked at, they push it off when they're injured sometimes because of their dedication to the sport?
So it kind of depends. And this is where when I get a team, I get to know my players and they understand where I'm coming from, because one of the biggest reasons they'll push stuff off is fear of being pulled from play, fear of not being allowed to participate, fear of not being able to contribute to their team and letting their teammates down. So what I let them know is, look, here's when I'm going to pull you. You're harmful to yourself and your teammates. And when we need to really address a situation, concussions, you're going to be pulled out. And believe me, I'm going to know you have it before you come and talk to me. So you might as well just come and talk to me. But ultimately, my goal is to give you preventative exercises, so injury reduction type activities to prevent you from having to talk to me, but I want you to come to me with everything before it becomes an issue so that we can keep you on the field. That's my entire motto. Keep people better longer, get people better faster, because no one has time to be sidelined. Whether an athlete or a general population person, you don't have time to be injured, hurt, sidelined in your life, because we all have families, we all have jobs, we all have bills, and those don't care if you're hurt.
Yeah,
That's right.
I'll tell you a funny story, because I'm a Brazilian Jiu-Jitsu black belt, right? And so one time we were training, and I got basically slammed on my shoulder and dislocated my shoulder, and it was like literally about 3 or 4 inches down into it. So I stood there for a minute, and like I dislocated my shoulder, and I'm just like laying there in pain. And I'm trying to push it back in, and my friends are like on YouTube going, "Hey, you want to stress?" I'm like, no, I don't. I drove myself home with a dislocated shoulder 45 minutes from where I was. I'm like, I called my house. I'm like, because they're like, do you want to go to the hospital? I'm like, no. And I'm like, I drove myself home. I cut my rash guard off. Then eventually looked at it. I was like, oh, yeah, I need to go to the hospital. And then went to the hospital, and they relocated it. But what's crazy is I didn't really feel too much pain until towards the end. I mean, I know I got my adrenaline going, but I think it's that fact that like I think like athletes are sort of sometimes at a different mindset. Like they're going, okay, I'm always going to get hurt. Always things are not going to feel good. Right. And they push it a little too far. Like the fact that I could drive myself home 45 minutes, cut my own rash guard off, and then decide I'm going to the hospital without really being in too much pain is sort of weird to me. That's why I was asking about athletes.
I mean, you do have a different mindset. You do have a different mentality. I had one of my high school athletes break their collarbone, and based on where they were hit, how they were hit, I'm almost positive it was 2 plays before they came and talked to me where they actually broke their collarbone. And they just came over and they're like, "Hey, I can't really lift my arm up that high." And I'm like, and they were wearing football pads, so I couldn't actually see the fracture.
Right.
So I like palpate into their shoulder, because I'm thinking, sprain, AC separation, because they're not in pain. I actually get into the collarbone and I'm like, "Oh, dude, I'm real sorry." And I just like start cutting his jersey, and he's screaming at me. And I'm like, "Honey boo boo, trust me. Trust me right now. You are not going back in that game." He's, I got to. My team relies on me. And I'm like, cool. Give it 5 minutes. You'll be fine. And another athlete I had, this was at the Australian Rules National Championships. Australian rules football is basically rugby meets soccer on a field that's 3 times the size, with 44 athletes, no pads, none of the safety rules in rugby about not hitting each other in the ear, trying to kill each other over a ball. And this is the national championships. And the last game of the day, all the rest of the medical had left, and I was actually just supposed to be there stretching one team. And that's when I realized, wait, where are my medics? Where are my athletic trainers? Yeah. One of my players got headbutted and fractured 6 ribs, and then that caused their lung to collapse. So, and initially they were like, no, I just need to catch my breath. I just need to catch my breath, in a very thick Australian accent. So I knew this dude had no idea. And I'm like, just come sit with me. Trust me. About 5 minutes later, they're like, I don't feel so good. And I'm like, facts. You don't feel good. So no, athletes are another beast. And that's where it's my job, when I'm on a sideline, to watch what's going on and actually predict what the injury has occurred, so that when they try to tell me they're fine, I can go, no, you need to take a minute and actually feel what's going on in your body. That's what I love about athletes. You know every ounce of your body. You know when something's off a little bit, and you can give really good feedback if you take the time to listen to yourself.
Yep. Yeah, it's true, because I knew, even like when it happened, like I knew my shoulder was separated. Like I knew the second it happened, like it was detached,
Well, I have done some shoulder relocations on sidelines. So those are always fun.
Yeah.
That's what you needed. You needed Dr. Mac.
Well, yeah, I did. Well, what was interesting is as soon as, I went to the hospital and they popped it back in, and like I didn't have, they didn't give me any painkillers or anything, but as soon as they popped it back in, it was just gone. Like the pain was like gone,
Mhm.
you know?
Absolutely.
I have a quick question though, because I've heard some negative things about chiropractors, and I would love to just like kind of touch on that real quick about like those misconceptions about chiropractic medicine. You know what I'm saying?
I d oh, I I absolutely know, and it actually goes even deeper into the profession where we are a actually very divided profession. There are kind of 2 camps of chiropractic. There are the evidence-based, using the research, doing what's best for their patients, getting them in and out as quickly as possible, making ethical choices in the treatment plans and how they're getting their patients better. And then there are those that are following the more historical philosophical basis, thinking that the basis of all disease is this mythical creature called the vertebral subluxation, and that you need 60 visits and to see a chiropractor for the rest of your life, or you're going to have all this disease and blah, blah, blah. No, there are definitely some issues. And even within the chiropractic realm, we look at some of them and go, oh, why? Why do you call yourself that? Because ultimately, we claim to be a patient-centered profession. Then we actually need to be doing what's best for our patients and look at the research to see where the direction of our care needs to go. And when we do that, we get patients better. We don't have to send them to surgery. We don't have to use harsh addictive medications. And we're being shown to be the best providers for low back pain and headache to decrease disability and overall return people back to their activities with the least amount of problems at the lowest cost. So there's been a number of research comparing exercise, chiropractic care with exercise, and surgery. And chiropractic and surgery, when they're combined with physical therapy, all have the same outcomes. The difference being we cost less money.
Mhm.
Plus, here's something that I always tell my patients, look, surgery is always there in the corner. We have that on the table.
Mhm.
But let's work as hard as we can to avoid that. But if we need it, it's there. Once you have surgery, you can't go back. And
Right.
it doesn't always fix the problem.
Right.
So
Right.
It's not, surgery is almost always invasive, right? I mean, that's just,
I don't know if it can't be non-invasive.
right,
that's-
exactly. Okay, I guess I was being nice to all the surgeons out there, but but it's so invasive. Like, why would you go that as your first route? To me, it just doesn't make sense. Like, look at the other routes first before you go into something that's invasive like that.
And I mean, there are times that surgery, hands down, is what you need. You have appendicitis, get that
Yeah.
out. You have a blockage or something going on in your intestines, yeah, go. You need a surgeon. But if you're having shoulder pain and it's
Mhm.
been diagnosed as shoulder impingement, the research is not supporting having surgery. It's supporting having exercise, whether that be with a physical therapist or a chiropractor. And if you have a good chiropractor, my definition of good, you really aren't going to be able to tell the difference between them and a physical therapist because they're going to get you in. They're going to do a thorough history. They're going to do a thorough exam. They're going to adjust or manipulate you depending upon what they find based on their exam. And then they're going to send you home with home exercises. Those home exercises are to give you control of your body. You should not be reliant on me to be out of pain. You should be able to take control, have the ability to go, okay, I'm having this discomfort. I do this, this, and this, and my pain is better. That is my goal, is to give you back the control that your body has taken away from you by giving you activities at home. What activities to give is really going to be based on each individual person.
Mhm.
Because when I have a patient coming in and all they want to do is go in the backyard and play catch with their kids, that's going to be different than when I have a Division I quarterback that needs to be able to throw a 50-yard bomb.
Right.
Those are going to be different rehab programs, but they all can be based in the same kind of theory of we start little, we go big. How big it is depends upon what your needs are.
Right. Now, you know, I guess this applies not only to sports, but to everyone really, because, your work focuses a lot on like the whole body, right? Like everything from brain to metabolism to everything in between. So how does that all kind of fall into what you do?
So this is really getting into kind of some of the pain science and understanding where pain come from,
Mhm.
where pain comes from and how it affects us, plus what we can do to mitigate it. So, definitely the biopsychosocial model of pain has stood the test of time of being the best model for understanding it. And where that comes from is one, there could be a biological cause. So, you could have an injury, you could have actually like an underlying infection or some other biological cause. You could have a psychological cause to your pain. So, maybe you hurt yourself in high school, you tore your ACL. Now, 10 years later, you're still having knee pain, especially with the movement that caused the initial injury because you have a fear based avoidance. Or it could be social. Maybe you have social anxiety. So when you try to go out in public, you get a headache. And there's those kind of biopsychosocial. So it's not to say the psychosocial piece is fake pain. It's totally real pain. It's just your body's response. And we need to take those into account. So that means it's forming an appropriate co-management team. I cannot fix every problem. I am a musculoskeletal specialist.
Mhm.
It means I need to bring in maybe a counselor or a sports psychologist to work through some of the pieces of the psychosocial to mitigate that pain from the root cause, where I'm adding in the rehab, the strengthening to make sure that there's no biological cause to the pain.
Mhm.
Right.
I get
So,
it.
so once you're injured, right? You mentioned like a high school athlete, right? You're injured and maybe you don't take care of it, and 10 years later it's bothering you. How much sort of exercise or routine do you need to do from the point of injury to make sure, like, what should you be doing to make sure it's not going to be or be as least bothersome as it can be in the future?
Oh,
Well, it's
that
gonna
that is a
depend on the
loaded
injury,
question.
I mean, doesn't that depend on the injury though?
Well, it does, but I guess my point is, should it be like, here's my routine and I should add this into my routine until like I feel no pain, or you know what I mean? Like, should it be like I'm always working at that weak point to strengthen it? I guess that's what I'm asking.
Okay, so prior injury, here's when you're in, so there's different phases of injury. You have an
Mhm.
acute phase. This is like your first 24 to 72 hours. Then you have your subacute phase, that's like your first like the 2-3 weeks, and then you have chronic and that's
Mhm.
everything past that. And what we're finding out is that when you're in that acute subacute phase, that is when the most amount of tissue remodeling, tissue healing is going to occur. And that's when you need someone that actually knows what they're doing. So, chiropractor, physical therapist that is following the best research to load you, give you the exercises so that the tissues remodel correctly. Now, long term, depending upon where you're at in your injury scale, how much it has affected you, what you're trying to do is really going to determine what type of activities you're going to have to do to maintain. There's always going to be a level of maintenance that's going to have to happen. Now, can we kind of mold those so that we're no longer doing rehab? Because it's
Mhm.
all about rehab to fitness. What fitness are we trying to work for? How can we work in what we're doing to your regular workout routine so it's no longer like, oh, this is a chore that fixes this. It's just your workout that you do. And it can be components where we tie it in. So when I'm working with, I don't work with jiu-jitsu that often, but when I'm working with my judo athletes and I'm going through their throws and we're working on their shoulders and their holds, we're tying in some of the rehab pieces to their functional activities. So it's no longer work. It just fits into what they're doing and they have
Right.
fun.
Mhm.
Gotcha. Okay. All right. So I have a kind of selfish question. And it's so here's my question. And I know you focus on athletes, but I think you can handle this. So
She-
so let's use, for example, my grandmother, because I think this will apply to a lot of people. She is overweight, but she's got bad knees. She's got all this stuff.
Don't let your
Like
grandma listen to this.
I know she doesn't listen, but it's okay because she knows. So, but she needs, right? She goes to the doctor. She says, I'm in pain. He says, you need to lose weight. but I can't lose weight because I can't move because I'm in pain. Now, like where is there a solution in something like that? Like is there a solution in something like that? And I'm sure there are a lot of people who would like to do this. I know a few more, but she's firsthand. So
There is absolutely solutions. And the biggest thing that holds us back is lack of imagination. So you want to lose weight, but you're struggling to move. So let's take weight out of it. Go to a pool. Do water aerobics. There's no gravity affecting your joints at that point, and you're able to get moving. Start doing yoga. There have been a lot of adaptations to yoga so that they're all done from a chair, especially for the older generation. Then we can start working through different activities. The biggest thing is to recognize that there's steps we can take just in the household to help, especially our older generation, move better and not have as many problems. Because a lot of times when we have individuals that have knee pain, we have in the past told them to stop doing things. Or when we had low back pain, hey, you need to lay down for a week.
Mm-hmm.
We're recognizing those are some of the worst recommendations we could have had. And we need to go with the physics principle of an object in motion remains in motion. So maybe it's simply working on squatting. It seems counterintuitive, but knees like to move. The more we move our knees, the less knee pain we have, which is why a lot of runners can run well into their 70s and 80s and have no knee pain. But yet non-runners are like, oh, how do you do that? My knees hurt so bad. And I'm a non-runner. I'm a go to the gym, lift heavy things like a dumb person and hurt my low back type of person. That's my mentality. Heavier the weight, the happier I am. But you want me to do cardio? That's not my thing.
See, I'd love
I'll lift the
cardio.
weights faster.
I'm with you. I am with you.
No,
But-
sweat it all out. That's my theory.
Exactly. But
when you're lifting
we need to
things.
move.
Yeah.
And it's hard. It's hard to convince people to move with pain because for so long we've said, oh, it hurts, avoid that activity.
Right.
We no longer need to say avoid, modify.
Mm-hmm.
We need to still move and do these things. And that's what's going to help people stay active longer. I was inspired when I got to work the senior national games, which is the equivalent of the masters level Olympics. All the athletes competing, I believe, are 65 and older. Oldest athlete was 109 years old.
Nice.
Oh my gosh.
I'm going for that. That's my goal.
Exactly.
I
I worked the triathlon, and the oldest athlete competing in the triathlon was 98 years old.
Whoa.
And I was just like, oh my God, I need to go run. I need to swim. I am so out of shape. And they competed phenomenally because they decided, I'm not going to let societal norms tell me what I can and can't do. I'm just going to go do it because this is what I want. And they did it.
Yeah. So it's grit. Like a lot of these people have a lot of grit, right? That's just, and that is a very athlete type thing. There's a lot of grit with athletes, but here's my question, right? You have someone like Nicolette's grandma. I'm not gonna say all the nasty things Nicolette said about her, but you have someone who hasn't taken care of themselves or whatever, or they're in the situation they're in. Is it that mental piece, right? Those small successes, like getting up and moving, and then building sort of that mental confidence that's going to let them get to the point of going for walks every day or whatever it is to get those, like you said, the knee moving or whatever the case is.
Yes. And that's where each person I work with, it's all about their goal.
Mm-hmm.
What do they want? Because a lot of times individuals that aren't motivated haven't found something that drives them to do. Oh, my knees hurt. Well, I just want a pill. I don't actually want to make any changes to my life to get better. They've already made up their mind that they're not going to be able to do it. So it's about finding those goals. Maybe it's, hey, I want to be able to go golfing and not have any pain, if that's an activity that they enjoy. Or maybe I want to be able to go shopping at the mall. Like that would be a motivator for my grandmother. She loved to shop. So when we wanted her to be active and we wanted her to walk more, be like, oh, Nana, we're going to go to the mall. Okay, let's go. Versus, hey, Nana, we need you to just walk around the house and do like 3 laps just so you're like not sitting there all day. And oh, it's no fun. Oh, well, let's go to the mall. Okay, let's go.
Mhm.
So it's about finding no one exercise is perfect.
Right.
No one activity is going to get people motivated, get people out the door, and get them doing what they need to do. You have to find that passion, that deep-seated love. Like I said, I'm not a runner, but if you put a deadlift bar in front of me and go, hey, that's 250 pounds, I'll go, okay, let's lift it. Let's go. That makes me happy. You have to find what brings you joy, whatever that is. And
Yeah.
that's going to actually motivate you to move.
Yeah. And I think it was, and I can't remember. I think it was Dan Gable who said like the easiest thing in the world is to go back in bed and pull the sheets over your head, type of thing. And it's so true. Like you have to work at these things. It's easy not to do anything. It's hard when you have to make the progression, especially if you have something wrong with you. You need to actually work harder at that progression.
Yeah.
Exactly.
Well, we talk a lot about, fitness and bones and things like that, and health and wellness and healing. But, there's something else that you focus on. And I think this hits home for both Brian and I. One thing you focus on is dyslexia. And I kind of was trying to figure out where this fits in. What does dyslexia have to do with anything?
Well, it's not so much that I focus as I live with it. I was diagnosed as a auditory dyslexic when I was 7 years old. I didn't learn how to read until 6th grade, and I still have a 2nd grade spelling level. So it's not so much a focus as just a umbrella that covers my entire life at all times.
Well, that is super cool. I know,
Yeah.
I know, it's challenging, but I think it's so cool. That is
Yeah,
so
my
cool.
two of my children are actually officially dyslexic. Have
Right.
been tested, and that's a tough one. Like people don't realize they don't like trying to get a school to put that say a kid is dyslexic. I mean, is like insane. And like one of my daughters. Well, actually, I'm sorry, 3 of them. Sorry, 3 of my kids are dyslexic.
Brian
One of
has like
them,
100 kids, so
I have
he
like
can't
I
get
have like 100 kids. I do, and I just keep gaining more somehow. but she would literally paint words like entire sentences completely backwards. Like
My
it
son
was,
does as well.
yeah, and it's tough. And I think I was slightly dyslexic, but I overcame it. And when I grew up, it wasn't so much people would label that, and the more I look at the history of my family, my dad was dyslexic, and it runs right through, but they're all, everyone who is like super creative and actually super smart, which is the funny part about it, so it seems like there's this gift in it. This is the way I see it. There's this magical gift in all of them because of the dyslexia.
It definitely, I think, but that's one of the characteristics of dyslexia is this learning disparity. You are incredibly good at one thing, but then you struggle in
Mhm.
other areas. So like for me, math, it was an easy thing. Like I could look at a problem and solve it
Mhm.
instantly. I completed every math class my high school offered in their curriculum by my junior year. I went and got a degree in chemistry because it was all math based. I started off in biology and then I realized there wasn't enough math and I switched.
Too many words.
Too many. I don't like this. I switched to chemistry. But it was one of those things where it is that disparity. But if you asked me to do a spelling bee
Mhm.
or a spelling quiz, I was in tears,
Mhm.
just so viscerally upset because it was going to take me hours to still spell the word wrong.
Mhm.
Close, but still spell it wrong because I
Mhm.
was going to superimpose letters, which is why, thank God there's spell check and I live by Grammarly. When I have to text my friends know there are just going to be Macisms and you just have
Mhm.
to accept them.
Yeah, Nicolette translates for me. I don't need Grammarly online.
It's true. I actually think it's fascinating, like the fact that, like you were saying about my son can like write whole things backwards. I'm just like, do you even do that? Like, I can't even, like, I can't get it. You know, if I tried to do that, I would be all messed up. You know, it's just, I think it's fascinating. I know it's a struggle, you know?
Well, it's mainly because the education is set up so that everyone is supposed to do the same thing and learn the same way. So it's basically everybody in the classroom is a bunch of monkeys and they need to climb the
Yep.
tree.
Right.
Then you have the dyslexic kids who are all fishes and they're going, hey, climb the tree. And you're like, how? What? I can't even breathe on land. So it's really just finding the learning style that works for you. I'm a very kinetic, hands-on learner.
Mhm.
I went into a hands-on profession.
Right.
It just
Right.
kind of all tied together really well and works for me. But what works for me doesn't necessarily mean it's going to work for other dyslexics.
Right.
Right.
I was very blessed with a supportive family. My parents went to bat and advocated to make sure that I had access to everything I possibly could need. But the thing that made the biggest difference was when they enrolled me in a program called 3D Learner. It's based out of Florida. It's now online and digital, but 3D Learner gave me the skills to be able to learn how to read. It gave me the skills to actually be able to understand the alphabet and understand how words go together, and then actually be able to take in information. As an auditory dyslexic, sounds, unless I'm paying attention, basically sound like the Peanuts teachers, just wah, 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 wah.
Mhm.
I have to focus in. I have to lip read to really be able to understand what's coming in, which is a nightmare in classes. And I'm really easily distracted by sounds. And
Mhm.
this has stayed on forever. So if I get a phone call and I'm in a room of multiple people chatting, I drive my husband insane. He has to repeat things 5 or 6 times before I'm able to take that information in and actually respond to it accurately. For the most part, I'm just going, huh? Huh? Why don't you just text me? You know, this is going to go better.
Yeah. You do this because I do this if I'm at like a big party and there's a lot of people like talking at the table. I'm just in my own world nodding. I'm just like,
Yes.
"Yeah, whatever,
Yes.
everyone."
Oh, absolutely. I'm just like, this
Yeah.
too much auditory stimulation. Here's my phone. I'm scrolling Facebook.
Yeah, I do the same thing. I'm just like, yeah, just nod randomly, at someone, make eye contact. Yeah, and give them a
I
thumbs up.
think that is super inspirational, though. I mean, look at, I bet there are a lot of parents out there right now who are feeling, overwhelmed by the fact that they have a child and they don't know how to relate. And, like, look, it's okay. It's going to be okay. I think that's a really important, inspirational message to put out there. I mean, look at everything you've accomplished. Come on.
Exactly.
It really comes down to the more people tell me no, the more I'm just like, oh, screw it. I'm going to do it anyways. I don't like, my first grade teacher told my parents that because I couldn't read, because I wasn't learning, I definitely was cheating on my math test because I was the first person done. And there was no way, I was too dumb to possibly be first done on my math test. And she was going to
Mhm.
watch me extra close to see me cheating. But they should expect me to barely pass high school and never get above a C average. And my parents were like, and we're moving schools now. So it's one of those things where just if you have a dream and you want to do it, do it.
Mhm.
Don't listen to people telling you no.
Mhm.
Yeah, and it's interesting too that you bring that up because I sort of went through the same thing with my kids and even as a child. And it's funny because, years ago, my mother was cleaning out stuff and she found one of those standardized tests for when I was a kid, and it basically like the math where you were just doing the actual math, like whatever the numbers, it was like 100, 99s, hundreds, in that testing. Then you looked at the comprehension part and it was like 6, because it was like, because I couldn't, obviously I was having trouble reading, whatever it was, but the actual math was like, it was easy, so it's interesting. You would have thought that they would have said, look, this is a typical thing for someone maybe who is dyslexic, like why not explore that? But they just don't seem, unless you're, to your point, unless the parents are advocating or you're really pushing for your child, it's very hard to get schools to say like, oh, is there something wrong? Or let's look at this a little bit deeper.
Schools will absolutely try to prevent someone being diagnosed as dyslexic
Yep.
because of the extra cost and the
Mhm.
required accommodations from the ADA.
Mhm.
Once you are diagnosed, this is a definitive learning disability, they have to make accommodations so that you can learn, and that costs money. So they're going to do everything they can to prevent that diagnosis, which means sometimes you have to go and see an outside psychiatrist or an outside psychologist to get the testing done, to get the determination. And that can be inaccessible if you don't have the money to pay for it, because it's not going to be covered by insurance. So it makes it very frustrating and hard for people to actually get the diagnosis so that they can be successful.
Yeah, I went through exactly what you're saying with my son. You know, basically had to fight the school tooth and nail, get testing done on my own. You know, crazy.
Well, not
It
that I
needs
went
to
that
change.
route.
Yes.
I went that route. I was trying to figure out where this fit in. That's why I had to ask. But I appreciate you sharing that. I think that's going to be helpful for a lot of people to hear, and very, very inspirational. But Dr. Mack, before we close up, I would really like to get some kind of insight from you for the audience about, prevention, right? Instead of, like you say, reacting, what can we do? What can the person listening right now just kind of do now so that maybe if they're injured down the road, their healing isn't so rough?
So I kind of have a standard 3 things that I always say, this is just overall going to help you be a little healthier. 1, drink water, not juice, not soda, not coffee, water, and drink enough that, there's no really other way. The best way to determine if you're dehydrated, look at your pee. You want it to be a pale yellow. So drink enough water that you're actually hydrated. 2, get quality sleep. And not just I've laid in bed for 8 hours, but I still wake up feeling like garbage. Going to bed, making sure you don't have electronics around you, maybe developing a nighttime routine. So if I want to get up at 6 a.m., I know my nighttime routine has to start at 8:30, where I'm getting my shower, I'm getting in bed, I'm reading my book. I'm starting to have that kind of shut down my brain phase so that by 10 o'clock, I can be asleep and get a solid 8 hours by 6 a.m. It's acknowledging the fact that we actually do have to go to bed. And therefore, making sure I don't drink too much caffeine too late in the day to prevent me from going to sleep on time. So drink water, get sleep. And the last one is simply move. Whatever that means, dance, walk, gym, jujitsu, just move. Those are going to be the 3 things to just set yourself up to overall be healthier. Now, when it comes to injuries, have in your back pocket a provider that you can go to so that when you're injured, you're not like, oh my God, I got to find someone. Already have them and have someone in mind so that you don't have to try to find them willy-nilly. And this is definitely important if you sustain a concussion that doesn't just occur in sports. You can get a concussion from riding a bike and falling. You can get a concussion in a car accident. Any one of those can cause that. And when you have that, you're going to feel nauseous. You're going to have a headache. You're not going to want to do the research. So I have 2 places that I always send people to look and see if they can find a provider. One is the Forward Thinking Chiropractic Alliance. That's the FTCA. They have a member map of evidence-based chiropractors. That is a global map. And then I also send them to Factor, FAKTR. And those are either physical therapists, massage therapists, athletic trainers, or chiropractors that are trained in Factor, which is an evidence-based rehab technique that I am biased to. One, I'm an instructor, but it's something that I've been working with for 5 years. And I just became an instructor because I was like, this modality actually allows us to decrease healing times. And an average concussion takes 10 days for an adult, and we can shorten that to 5 or 6 and have full recovery. So it really allows us to shorten because we're giving the right rehab, we're giving the right loading, we're getting people better faster.
Awesome. Well, thank you so much, Dr. Mack. Can you just let everyone...
I was about to say the same thing.
Can you let everybody know where they can learn more about you and your practice and your work?
Absolutely. So I have my own podcast. That is the Mac Performance Podcast. It is a health and wellness podcast that will whiplash you back into health. We cover a different topic each week with guests from around the globe. I then also have an Instagram, and that's MacP_clinic. And there is a link tree that literally has every link that ever existed for me to find, and easily you can reach out to me there. And if you're struggling to find a provider, maybe the resources I have didn't find one in your area, please reach out. I am happy to help you because I am just passionate about making sure people are able to do the activities they want with the least amount of restrictions and work with ethical providers.
Thank you so much. Thank you for the time today.
Oh, thank you for having me. This was wonderful.
Pleasure meeting you, Dr. Mac.
Pleasure meeting you as well.